If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner. Welcome to Ask the Doctor. This series was created to assist you in understanding medical issues so you can take charge of your own health. This is our 8th season, and we are now airing once a week. Now, this is a live call-in show, so have your phones nearby. In case you don't get through, you can still submit your questions via the internet. Visit netny.net/askthedoctor or let me know what's on your mind. I'll take those questions for future discussions. Well, this was a busy news day, so I'd like to go straight to the news, and then we'll come back and meet the doctors, and we have a great crew. One thing that I want to point out, we had a momentous occasion at Methodist, at New York Methodist Hospital Radiology Department. PS 321, which is in Park Slope, paid a visit. Miss Melissa DePinto's first grade class visited our radiology department. Very smart group of first graders, and it was a pleasure to have them and have them as listeners to Ask the Doctors. So thank you for tuning in. Now let's get to the news. Well, a big breakthrough in cancer treatment. Cancer of the stomach is a dismal cancer, very low survival rate, usually less than a year. By using a drug named Herceptin, this is a drug that's used in certain breast cancer patients, people were able to extend their life by about 30%. And this is a big number, and this can lead to even bigger numbers. And the way it works is the cancer produces an abnormal protein, and this protein tells the cells of the body, keep dividing. And as it divides too much, this is what cancer is, as cells begin to grow too rapidly. The Herceptin gets into the cell and says, no, stop dividing, and tells the cell to behave normally, and it begins to listen to the cell. And it works for a while, and then the body overcomes it. The trick is now to find a way to make it last even longer. But this is great news, and anybody who's got stomach cancer or know of somebody with stomach cancer out there should be tested to see if they would be good for this type of medication. Another major treatment that just came out is a vaccine for cancer. And one of the reasons cancer occurs is that the body doesn't recognize the cancer cells as being a problem. So the cells start to float through the body and metastasize and get all over because the body doesn't recognize that they're dangerous. This particular treatment, this vaccine, teaches the body to recognize cancer cells that are dangerous. And it does it in an ingenious way. It takes something else that the body recognizes as foreign. And what they use is shellfish protein, where the body says, wait, this shellfish doesn't belong in the body. They take the shellfish and attach it to the cancer cells outside of the body, then inject it back in. When they start floating now, the body's own cells begin to notice that there's a problem, and they attack the cancer cells as well as the shellfish protein. And there have been cases that are living as long as 5 years, longer than expected, with different types of cancer: skin cancer, melanoma, prostate cancer, lymphoma, very difficult to treat blood cancer. So it's something you want to ask your doctors about. It's in trials right now. Perhaps you can get involved in these trials. An early test for Alzheimer's disease in the news. One of the problems we have is we don't know when somebody has Alzheimer's, is it forgetfulness, is it Alzheimer's, and when do we start treatment? This test, which will be available in 1 year, is done by skin cells that you scrape off and send into a lab. And the lab tests it with various chemicals and can tell if you have Alzheimer's disease. Remarkable, because we've been unable to find any test like this. We've used expensive brain scans and so on. This is a relatively cheap test. It would cost about $100, and you can do it at home. Addicted to the sun. We talk about how dangerous the sun rays are, yet everybody knows it, yet love to go to the beach, right? Dr. Morano loves to go to the beach, I know, right? You like to get a good tan.
Outdoors.
What happens is the brain, when you get the sun, gives off endorphins, and these make the body feel good. And people actually get addicted to the sun. In spite of the fact they know it's not good for them, they continue to want to get out there. And you know who you are, like if you're in at lunch, you go outside and you sit on the stoop and put your face up to the sun just to get some extra rays and check your tan line all the time. So this is something that we have to look out for. And what do we do? Well, if you know you're addicted, then we have to try and figure out some kind of therapy to get you unaddicted, much as you're addicted to alcohol or gambling. So it's something, suntan is anonymous. Okay. Simple, thank you. Simple vitamin pill that really works. Folic acid. All young women of childbearing age should be taking folic acid. This is a simple vitamin B tablet. They found that people who are taking enough vitamin B when they're having babies have a 50% less chance of having a premature baby. Now this is big because premature baby requires a lot of medical care, may have associated problems later on in life. So if we can prevent this by a simple folic acid pill, I mean, it's amazing. And one of the things that is changing is the dosage. You should consult your doctor, but it's doubling. The new recommendation is going to be instead of 400 micrograms, 800 micrograms. So make sure that you speak to your doctor, and all women of childbearing age, whether you're pregnant or not. And finally, light at the end of the tunnel. It looks like the swine flu. We're beginning to see it's very contagious, but it doesn't seem to be as deadly as the other flus that we've known. It's probably going to head south now for the winter in Australia and South America. Hopefully it doesn't mutate and become much stronger. This is something we're going to be looking out for carefully in October, when hopefully we'll have a vaccine. So that's a busy news day. I'm out of breath already. But we have to now do our quiz that Dr. Eugene Hagawara, we have an official puzzle master here, and he's come up with this quiz, and I want to see how many of you at home can come up with this. Now, the first one who calls gets the coveted plaque that we talk about each week. Take an animal that has the letter F in it. Right? Any animal has a letter F in it. Remove that letter F, and the letters you're going to be left with can spell another animal. What are the two animals? No hints, nothing? Whoever calls in first gets the plaque, fair and square type thing. I want to thank Monsignor Bennett again before we go to break. Monsignor, eight straight years Monsignor's been at every show. So thanks, Monsignor, for coming. And we're going to take a break so I can catch my breath. And our phone number is 718-499-6101. You're going to be able to talk about geriatric medicine, radiology, and rheumatology. So remember, we're going to take a short break, and when we come back, we're going to get right to our guests and to the phones. The number is 718-499-6101. We'll be right back. Hi, and welcome back to Ask the Doctor. As we said, our topics tonight will be geriatric medicine and rheumatology. And let's meet our guests. I have Dr. Margarita Khotsyna. Hi, it's nice of you to be here again tonight.
Hi, it's nice.
So what's going on in the world of geriatrics?
But I think it's geriatric has been the field of medicine that deals with the people who are 65 and above. And I think that we have to see more and more patients lately because we're dealing with a population that has increasing in numbers. I still think that it's the geriatric medicine is somewhat underappreciated and underused. So I would definitely encourage our viewers, if you are above 65 or you have relatives who are above 65, please ask your doctor to refer you to the geriatrician.
I think that's well said, because you wouldn't take a child to an internist. You want someone who specializes in pediatrics. You know the problems of the senior citizens, and you know how to not overtreat them, because a younger doctor who deals with a younger group may be more aggressive in treatment, which actually may hurt the patient.
Yes, and plus it's even the very common medications that are frequently used in younger people may have absolutely different effects on the older population. They require much lower dosages, and the side effects are much more frequent.
So thanks for being here. We have a big night ahead, and we'll go to Dr. Morano, who gave up a dinner of truffles and caviar at the New York Methodist.
For my friend here, Steve.
And also likewise for a friend.
Thank
you. You like those truffles, don't you?
Love them.
Yeah,
black truffles, white truffles. The truffles are usually, found in France. Well, this is a food show.
We like to talk a little bit.
But truffles are discovered either by dogs or hogs, and they're buried on the ground. And you get them either from Italy or France. There's always a debate who have the best truffles.
I wonder how the first person knew that truffles was something you could eat.
He must have been hungry.
He must have
been very hungry.
Yeah, I don't know. That smell is... And tell us a little bit about rheumatology.
Oh, rheumatology. Rheumatology is basically a study of arthritis and autoimmune diseases. Anything from osteoarthritis all the way to lupus, as well as vasculitis. So have those questions.
Joint pains, all these aches and pains we're going to get to with Dr. Morano, who's always been one of them. I actually have the two people here who have been our two most popular
Thank you
guests.
very much.
We have a surprise guest coming in towards the end of the show. I want you to stick around for that. A radiologist, excellent radiologist, who's going to be Dr. Lapidus, who should be here shortly. So let's not turn off the set at this point.
All right.
And I think we should go right to the call. So on line one we have Anna. Hi, Anna.
Hi.
Hi, where are you calling from?
Manhattan.
Hi, Anna. You're our first caller of the day.
I'm glad because I called the other day, but I couldn't get in.
Now you're in. Now which part of Manhattan?
94th Street and 3rd Avenue.
Oh, that's a nice. I know that address very well, very well. So what can we do for you?
Well, I call about, first thing I have Syndrome X. That's what the doctors call it.
Syndrome X.
I'll take care of
Yeah.
that.
And then they say that when I get the pain in my chest and I go there, they give me all kind of tests and they say I don't have any of those things. But it really bothered me. Like 15 days ago, I got it, and I thought I wasn't going to get out of it.
How old are you?
84.
84. That's why
84,
I'm glad I have Dr. Khotsyna here.
Okay, Anna, what exactly your symptoms are?
I get a pain in my chest, and then sometimes it goes up to my gums. And then sometimes it goes down my arm.
You know, the symptoms that you've been describing sounds very typical for any kind of a heart disease. So before even all your symptoms are assigned to Syndrome X or some other causes, the main thing that your doctors should do, and I'm sure they have done that, is to look for the cardiac problem, to the problems with your heart vessels.
They have, because I've had like 3 angiograms already. I've had echograms, and I've all kind of different
Always
things.
negative. It's always negative, right?
Yes, everything
negative.
comes out negative, but I'm afraid because they just say that the women, they don't care, they don't think they have something, and it happens. Like the pain I had, I was alone at home, but
And what
thank God
usually-
it went away.
Yeah, Anna, what usually helps your pain?
They gave me what you call that thing, nitro
Does it help
spray
you?
to spray in my mouth.
Does it help you?
Yes.
So the other explanation, by negative angiograms may refer to the angiograms when they found no significant disease. So it means that they didn't find any blockage, but there could be potentially some cholesterol areas with the cholesterol, and this is probably can cause your pain. So the conditions the symptoms that you have are caused by angina. So
I don't know, that's what another one thought it was angina, but when they did all the tests, they said it wasn't that. In fact, he told me don't come back here because there's nothing wrong with your heart.
But
Anna, the other thing to look at, you may look at just speak to your primary doctor, because sometimes the nitroglycerin can help if your chest pain are caused by the spasms of the esophagus. And it can also give you not exactly, but similar symptoms. So if you can please speak to your doctor and ask him to maybe refer you to the gastroenterologist to look at your esophagus. This is, I would think, another venue to explore.
One that did. One of the heart doctors sent me to the gastroenterologist, and what he gave me was Nexium, which I was already taking.
But Anna, and I think Dr. Khotsyna is saying that maybe helping your esophagus may not be easily identify the problem. But I want you to have a good week ahead. You're going to call us next week? Is that a yes?
Well, I hope I'll be here to call
You'll be
you.
here.
Yeah, you will be.
I
Yeah, you
have
certainly.
rheumatism also.
Good luck.
Yeah, you
Good luck,
certainly
Anna.
will be.
Huh?
Good luck.
Good luck.
Okay.
We'll see you next week.
Okay.
Take care. Let's go to Joel now. Joel.
Hi, Dr. Garner.
Hi, Joel. Joel usually has a contest with Maddie, who's going to be the first caller. Now, today you got beat out by Anna.
I don't know what's going on. I can't win here.
He's slipping. But
You had a great in the news today. That was the best ever.
oh, thank you.
Interesting stuff.
Thank you. So, what can we do for you?
I had a question for the radiologist, but I'm gonna ask a question to Dr. Morano, the rheumatologist,
Okay.
if I may. So, Dr. Morano, I work with my hands a lot. I do a lot of art stuff, and every couple of months or so, I can't bend my wrist. I can't flex it, and it seems to happen when I use the computer a lot. And it stays for about 2 to 3 weeks. So, I keep it in a brace at night, and it helps a little bit, but not really. What do you think about that?
Well, I don't know what occupation you're involved in, but overuse syndrome is a common problem in non-ergonomic work conditions. And that could cause sprains and strains of ligaments and tendons, and so you might be overusing the wrist. There's other things that could also occur. if it's an acute event or it's a chronic event, such as arthritic problems, osteoarthritis can occur in the wrist, rheumatoid arthritis can occur in the wrist, carpal tunnel syndrome. So there are a number of things that need to be investigated. You basically need to be examined, especially when you have limitation of movement of the wrist. So, but I would, come and see either me or another rheumatologist or whoever you want to see. A hand specialist also could take care of him. Therapy could be used. There's so many different things that you could try, but you need to be examined because there's a lot of things that could lead to what you're describing.
Okay, I'll
Good
see
luck,
somebody.
guy.
Thanks,
Thanks a lot for the call. Have a good week.
All right, thanks a lot.
Thank you. Loyal listener to the show. Never misses a show. We have Mary on line 3, and there's a rumor that, Mary, that you might have the answer to the quiz.
Yeah.
Is that true?
Yeah, I think so.
All right, now I want you to take a deep breath because I notice a heightened motion period.
Okay.
What's the answer?
I said fox, and fox is ox.
Wow.
I tell you, Mary, if we had music here, you would get a fanfare, music, drum roll, everything.
Am I right or am I wrong?
You're absolutely right. And how did you get it?
It was very easy.
I'm working on that.
Still working on it.
It took me a week to get that thing.
What? It took you a while to do it?
I'm sorry, it took me a while. When Dr. Hagawara gave me that question, it took me a while because
Now,
I didn't
let me bring out a point to you. I'm not too cerebral, but I was able to do it right away.
Mary, always thanks for the kind words, but flattery is
Now,
going to
what
get
am
you
I
nowhere.
going to get for this?
Now, this is the deal. There's a plaque, handmade in Japan, okay?
Really?
It's a beautiful plaque, imported, and in it says that you're a winner of Ask the Doctor, and I think you're our 6th winner to date. It'll have that number with my signature on it and your name.
Thank you so much.
Okay, so what you need to do is you need to give the station your address.
I did.
Oh, great, and you're going to get the plaque. Look within 3 days. I would say by Friday, Saturday.
Now, could I hang this plaque up on the wall?
Where would you hang it?
On top of my brain, because that's where I got the answer from.
Would you,
Brains.
on top of your where?
Brains.
Brains. So
What?
you'd look at it as you sleep. It would be above your bed where you sleep?
No, I'll probably put it on my wall somewhere in my house.
As
my
long as it has a
apartment.
prestigious spot.
Thank you so much.
Thanks, Mary. Thanks a
Yes.
lot. All right, we feel like we did a show and a half already, so what we're going to do is we're going to take a break, and it may be, I'm not going to swear, but we may have the other radiologist. We may have the radiologist here at this point. So we'll take a break. The number to call is 718-499-6101. You can talk about geriatric medicine, radiology, and rheumatology. So right after this short break, get ready. We'll be back.
This is Broadcast Bulletin.
I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. Hi, welcome back. And as promised, you see, we teased that we're going to have this radiologist here, but we actually do have the radiologist here, Dr. Claudia Lapidus, who is making her initial appearance on Ask the Doctor show. I know.
Bravo.
Yeah, this is a very talented radiologist, so we're going to be talking about any of your radiology issues. You may have mammogram issues, MRI questions, and so on, and Dr. Lapidus can help to give us that. Just a little background. Now, I know you live in Brooklyn, New York?
Yes. I live on Ocean Parkway, the end
Don't
of
give,
Ocean
we got a shady crew. They'll be at your house now. So, but what we do like Brooklyn. I know that you like Brooklyn. Everyone actually
Everybody
here
actually
loves
likes
Brooklyn.
Brooklyn.
I really do.
So give me I think number one thing in Brooklyn, if you got guests coming in from out of town, where do you take them?
I actually take them to the boardwalk. I enjoyed walking on the boardwalk. I love the ocean. And I think that's a great advantage of being in Brooklyn.
Tranquil, right? You're walking out there, you're looking out at
the waves. It's beautiful.
And those restaurants, right?
Yes.
What's that nice restaurant out there?
Tatiana.
Tatiana. You ever
Yes.
go into Tatiana?
That's
Yeah.
very nice.
What a nice, that fresh fish and the watermelon and the salad. If you want to go to a good place, you think you're in Europe, right? And yet, if you like sunflower seeds, this is the place to go because you see people eating sunflower and little poodles, right?
Yes, it's really a different culture. It's a little bit of Russia in New York.
But very peaceful, one of the safest spots you can go. So something you'd like, and I know you had a happy occasion last week.
My son graduated from college, so I'm very happy with that.
This is, we'll give a little applause for that.
Kudos.
What's his name? We'll throw it out.
Daniel.
Give Daniel a shout out. And you have another talented young one at home.
Yes, Mitchell.
That's one of the toughest, Stuyvesant, one of the toughest high schools to get into. So,
Right.
Thank you.
so now you know Dr. Lapidus. So let's
Personally now.
You have her right. Let's go to Mickey now. Hi, Mickey.
Hi.
Mickey, how are you?
I'm very good.
Where are you calling from?
I'm calling from Brooklyn and Crown Heights.
Crown Heights. We had a tough one last week. We're trying to think of a good restaurant in Crown Heights. Is that possible? What?
I don't eat out much.
Tricky one.
Yeah.
Where do you like to go when you do go?
When I eat out?
Yeah, when you get out of, where would you go?
I would actually probably go to some of the restaurants in Park Slope.
Oh, they're nice, right. Yeah.
They're beautiful.
I was at Pepperoncino last night. Did you ever go there?
No.
Very good. $21, 3 courses.
Wow.
You don't even get that sick at the end of the meal. Very good. Okay. What can we do for you?
Well, I was diagnosed with sarcoidosis in 2006.
Okay.
And I was wondering if there was a cure or if there was something I can do on my own to ease the joint pain.
Okay, so we're going to get to Dr. Morano. Dr. Lapidus is a radiologist. What's the tip-off that someone has sarcoidosis?
Well, the most common findings we find on the chest x-ray. We take a chest x-ray and you can see adenopathy.
Those are lymph nodes.
Lymph nodes in the hilar region. So you see nodes and you see changes in the lung. And they're very classy in appearance, so we know we bring a differential of sarcoid. CAT scan is very, very sensitive. CT of the chest can show changes in the lung very nicely.
Mickey, how was it diagnosed in your case?
Well, I definitely my lungs, skin, and eyes are affected, especially my lungs and my joints.
Okay, so Dr. Morano, is there hope? Is there a cure? Anything that can help out?
Right.
As you know, there's sarcoid, and then there's sarcoidosis. And what I mean by that is most people do very well with very little treatment. There are some people who have a problem, and then there's a very small percentage of people that it's a very fatal disease.
Right.
What's his name? Bernie Mac.
Bernie Mac?
Yeah, he died from sarcoidosis, from what I understand. So it could affect multiple organs, the brain, the heart, the lungs, lymph nodes. We see it also in the joints, especially in the fingers, especially these 2 fingers.
Really?
Quote, unquote.
Very good. No. You know, Dr. Morano's a little quick for me. I'm a little slow. You see what Mary said about my intellect. So, yeah.
So there are a number of treatments. One of the treatments that we do use, especially for joint problems, is a medication called Plaquenil, hydroxychloroquine. The disease is more prominent in African American women, so you have to do a screening test, especially in that group of people, for G6PD deficiency because they can't take this medication. But it can help, especially with joint. And there's always steroid use. We use steroids a lot in sarcoidosis if needed.
Mickey,
I do.
What are you taking, Mickey?
I'm taking prednisone for the eyes. And right now, they say that I don't really need medication for the lungs yet, but I noticed that I'm always short of breath.
Interesting. You have a good pulmonologist?
Yeah, the problem with that is I'm waiting to see him. He's so good that he's very popular, and I'm on a waiting list.
Well, don't wait too long.
Give us a call. Maybe we can help you out, okay?
Okay.
Give me a call at the Methodist Hospital, the number, and we'll try and get you in.
Okay.
Okay, Mickey?
Thank you so much.
Okay,
Good
be
luck
well.
to you.
Take
Okay,
care.
thanks.
Mary.
Yes, hi.
Mary, how are you doing?
Fine, fine, thank you very much.
Did you know the answer to the quiz or you didn't get it?
Yes, no, I certainly did. My husband asked me, he said, what animal starts with an F? And I said, ferret, and then fox.
Oh.
And I said, oh my gosh. He said, that's it, fox.
You missed it by 1, by 2. You know, there was another Mary that won.
Oh, yeah, okay.
Next time, right?
Next time, that's all. I'm new to your whole program.
Oh, you're
and
new?
It's very, very interesting. I'm learning a lot.
So, where are you calling from?
I'm calling from Tottenville, Staten Island.
Staten Island. A nice, I actually ate at Staten Island Henny's this week. Do you ever hear of Henny's?
Oh, absolutely. They were there for many, many, many years.
Right. It was very nice. Do you like it?
Yeah, well, I've never actually gone there, no.
Very nice. One of our doctors, George Smith, our plastic surgeon, actually his father owns it. Excellent place. I go in there and mention Dr. Smith, they give you wine.
Oh, wonderful. Yeah. Well, wonderful, but I can't have wine, so let's go for grape juice.
Well, let's hear your problem.
Yeah, we'll go for grape juice. Okay. I'm 68 years old, and I know certain things will occur, when you get older, like arthritis and whatever, and I accept that. I understand it. However, about a month or so ago, I started to get a pain on my left hand of the thumb muscle, the muscle that's just behind it goes from the second knuckle, thumb knuckle, I guess, up to the wrist, and there's a muscle there. That started giving me a lot of pain. I massage it. I thought maybe it could be arthritis, but I don't know if it could be indicative of something else.
Okay, and Joel had something actually in his hand.
Everybody's giving me a hand tonight. You notice that? But there is a muscle here in the thumb area you're referring to.
Yes.
And that's one area that, especially as you get older, is involved, especially what they call the carpal metacarpal joint.
Right.
Is one of the most common joints involved in osteoarthritis, which is a wear and tear. Also, you see that area involved with carpal tunnel syndrome.
Right.
And that's another condition that you have to be aware of because it can give you pain as well as numbness and tingling. There's another condition called de Quervain's, and we tell people to do the Finkelstein sign. You know what the Finkelstein sign is?
No.
You put your thumb out, thumb in, and then close it, and then yank on it. It pulls the Latin pollicis.
Yes. I don't
pollicis, the thumb. The brevis and the longest tendon of the thumb.
Was that named after Mr. Finkelstein?
Mr. Finkelstein,
I had him as a teacher in 4th grade.
Me too. We were in the same class. But anyway, so that could be a tendinitis, a tenosynovitis of the thumb. But what you're describing sounds to me as if you're developing osteoarthritis in that area.
I want to ask Dr. Margarita Khotsyna about, do you see many of the elderly with a problem with arthritis in the thumb and the hand? Is this something you see a lot of?
Yeah, I mean, definitely. As people get older, those kind of diseases become much more frequent. But I still strongly believe that if you get older, you don't necessarily have to become sicker and weaker. It's if you get 65 and above, you can definitely lead a full life, and don't think that if you're getting older, everything will deteriorate. And again, if you develop any problems, speak to your doctor and address it, and don't really think that it's just because you're getting older.
And Mary, I know Dr. Morano gave you a big list of possibilities. Dr. Lapidus, maybe she can help us with another test.
In terms of imaging, if we're thinking that this is osteoarthritis, a plain film of the hand will show it. If it's not, if we take a plain film and there's not much arthritis, and we do want to look at the muscle or the tendon, then the best test would be an MRI. So a plain film of the hand can show arthritis. If that's not there and the possibility is tendinitis, then MRI would be helpful.
So Mary, hope you helped, and hope this has helped.
Can I ask you one other question?
Quick one.
Okay, my husband has cancer. He eats a lot of peanut butter and honey for energy and whatever. He likes it. And someone had told him that can lead to gallstones, and also he should take olive oil and canola oil mixture, a tablespoon a day.
What type of cancer does he have?
Non-Hodgkin's lymphoma.
Okay, he's in remission?
No, he's not. He's being treated with a form of chemotherapy.
You may want to ask your doctor about the vaccine we talked about at the beginning of the show. It's been found to be helpful in cases.
That heparin? Or?
The vaccine for cancer.
Oh, okay.
Not the Herceptin, the other one. So ask him about that.
Okay.
Okay, but as far as gallstones?
I I don't know.
Not really.
You know, not really.
No.
But from the other hand, I guess you just logically is you have to avoid a lot of fatty food, and of course, everybody knows that you have to substitute your saturated fats with the not saturated fats. And olive oil, of course, it's good, but in moderate amounts.
Moderation. Okay.
Okay.
Take care. Call us back next week.
Thank you. I certainly will.
Take care. Hi, Angela.
Hi, good
Hi.
evening.
Been waiting patiently, huh?
Yes, sir.
Big list. Did you have the winner of the quiz too, or you didn't get it?
No, actually, I didn't get it
Good,
this time.
good. Because I felt bad. I didn't get it. I'm telling you, but that was hard, no?
No, you did excellently.
Thank you, thank you. Where are you calling from?
I'm calling from Kew Gardens Hills.
Oh, nice place out there, actually. There, you got plenty of restaurants in Kew Gardens Hills.
Yeah, well, I usually head to my old neighborhood of Astoria. They have better restaurants.
Oh,
I was at Piccolo Venezia this week. Do you ever go there?
No, I don't.
In Astoria, delicious restaurant. Excellent.
L'incontro.
I'll have to give it a try.
Very good. L'incontro.
I didn't speak French, but...
That's the time.
Okay, that's why I didn't know. What can we do for you?
Well, my question is for the rheumatologist. I believe his name is Dr. Morano.
Yes.
Well, I have, my rheumatologist told me that I have the markers for Sjogren's syndrome. I believe it's an ANA marker. And basically, he has put me on a regimen of Plaquenil or hydrochloroquine every day for, I believe it's 300 milligrams or...
It's 200.
And my sister has the same thing, and her rheumatologist told her, no, that it's unnecessary. Like, my doctor has me on it as more of a preventative type of medicine, but I'd rather not be taking a medicine at all if that's the case. I was wondering who's right.
Well, let's just, ask Dr. Morano first, in 30 seconds, what's Sjogren's syndrome?
Sjogren's syndrome, also referred to as Sika syndrome, is dryness of the eyes, xerostomia, and also mouth. Erophthalmia, xerostomia, mouth and eyes. And it could be a primary condition or it could be associated with other collagen vascular conditions. So when you have a positive ANA, that's a screening test. If you have true Sjogren's, you should have SSA, SSB antibodies positive, and you should have this, and you should have the symptoms. I personally would not treat people who have a positive test without having positive symptoms. So there's different, rheumatologists, different ways of treating people. I personally would not give a Plaquenil unless there are symptoms to support the findings.
Hope that helps.
Currently, other than just being fatigued, which I've just been this way ever since I was like 18, and that's quite a while now. I've just always been fatigued, and I never knew what it was. But other than that, I don't have any symptoms. And the SSA and SSB, I believe, are both negative.
So, again, an ANA is non-specific. It could be seen in so many different conditions. But you need to do a differential as to finding out why you have an ANA. And again, a good percentage of the population just has an ANA without any disease. Good luck to you.
Thank you very much.
Thank you so much.
Good night. Take care. Let's go now to Brian, who's waiting. Brian, who's waiting patiently and gave up, I think. Brian. Okay, call back. We'll get to Brian in a minute, okay? But luckily we have a lot of other calls coming on. Hello? Okay, so we have two other people that are holding on. Let's see if we can entice someone to pick up. Hello? Hi, how are you?
Fine, doctor. How are you?
Hi, where are you calling from?
I'm calling from Scrantonville, Staten Island.
Ooh, sounds like Scrantonville. Doesn't it sound like a far away? I never heard. Is that a well-known town in Staten Island?
Yes, it is one of the smaller towns.
Where is that? What's the highlight of that town? What would you take people to see in Scrantonville?
Near South Avenue, and I just, the zoo, Staten Island
Zoo. Oh, the zoo is
they have
good.
a good zoo.
The zoo is good. South Avenue, I don't know much about, but the zoo is good.
Right.
What can we do for you?
Well, I have an 18-year-old African-American male who's relatively healthy, but he's been having a white blood cell that is slowly decreasing. It started 4.3 to 3.4, then 3.1. And he's been seen by a hematologist, and he had another test for these results, and everything was normal. So he had a Hep screen, and vitamin B12 and lupus was negative. So I was wondering what is causing his white blood cells to be low.
Is that your son?
My grandson.
Your grandson. Okay, I want you to take a step back from the TV because we're getting a little feedback.
Okay.
And we're going to hear what can cause a low white cell count in an African American.
But I think it's, you just mentioned the number of tests that your doctors have done, and you pretty much went through the differential. The other potential causes is something that we call, it's just benign cause. It's, it is pretty common in African Americans. So as long as all other causes are excluded, which has been done by your doctors, you just follow it and don't do anything else.
You know, we sometimes see this in an African American and don't get crazy about it because it's just a normal, we call normal variation.
Well, he's mentioned that if it goes down to 2 point something, he would do a bone marrow test. And I wanted to know what was the side effects of a bone marrow test if he had to have it.
Bone marrow test, it's a pretty benign procedure, and it's usually done to evaluate for the presence of a bone marrow disease, because sometimes, usually the blood cells are produced by bone marrow, and when there is something affecting the bone marrow, the number of cells decrease. So your hematologist was is concerned, and apparently you do have a very good follow-up, and your hematologist is planning to follow and repeat the blood test for your grandson as needed and do the bone marrow. Except for it being maybe uncomfortable procedure, I don't see any side effects. But usually the doctors give a numbing medication in the site where the injections is, the puncture is to be made. And so it's a very common and ambulatory procedure. So that's, you go to the doctor's office, have it done, and just leave the same day.
You know, we may be able, Dr. Lapidus may be able to offer some help as a radiologist to look for certain signs, either in CAT scan. What would you be looking for in someone with a bone marrow disease causing progressive decrease in white count?
Well, I would be more looking at, to make sure, just look at for nodes, for lymph nodes, looking for spleen size to see if there are any other causes that I can identify for hematologic disorder. So looking at the spleen, looking at the lymph nodes, and on a CAT scan we can also see the bone. We just look at we can see the bone pretty well. So if there's any specific areas which are of concern, then the doctor can go to that site. But in this case, it sounds that it's just a general bone marrow biopsy, wherever that the iliac crest would be the best site.
So I hope that helps you. I think we gave you a good differential there.
It's very helpful. Thank you very much.
Be well. Enjoy the zoo there. Let's go to Bob now. Hi, Bob.
Okay.
Bob, you waiting a while?
Yeah, I'm waiting.
We're ready for you.
All right.
You nervous?
A little bit.
Where are you calling from?
Flatbush.
Oh, not far from where I live. Which part? This is why you can't get home at night. He has a hard time knowing where do
Hello?
you... Yeah, hi. Which part of Flatbush?
Up there by the junction.
Oh, how did they build that? What did they build over there? I saw some big...
yeah, I think it's a Target.
Looks beautiful.
Yeah.
Yeah, what can we do for you?
I'm a healthy 51-year-old African American. I have never had any problem. I started to operate a machine, and I was operating from a standing position, and I started feeling some pain in my shoulder. And I used to ignore it. And then after about, after a while, I started associating the pain with what I was doing. And, like swelling and pain. One time it got so bad I had to go to the hospital emergency room. So the doctor told me it wasn't breaking. I should see some orthopedic surgeon. Well, I thought it was probably muscle weakness, and so I started on a high exercise regimen trying to build up my muscle. But now it gets to the point where I feel the pain in my spine, and then I feel like numbness in my head. And somebody told me that I might have rheumatoid arthritis.
Let's ask Dr. Morano what he thinks.
The shoulder is not one of the most characteristic joints to have initiation of rheumatoid arthritis. But what the work that you engage in can lead to osteoarthritic changes, and the shoulder can have osteoarthritis. And I would have to examine you, but the shoulder can be involved in tendinitis, rotator cuff problems, the rotator cuff that lifts up the arm. You could get what they call impingement syndrome if there is arthritic changes in the acromioclavicular joint, which is a joint where the clavicle meets up with the shoulder blade. And the shoulder pain could also be a referred pain from your neck. And if you have arthritic changes in your neck, it can constantly give you pain in the shoulder. So you would really have to be examined and be asked multiple questions to ascertain what is the cause. But at 51, in the work that you engage in, my guesstimate would be osteoarthritic changes of the shoulder with possible tendon involvement.
Very good. Bob?
Yeah.
Did you have any x-rays?
No. I went to in New Rochelle, and I had the orthopedic surgeon x-ray my left shoulder, and he said that nothing was broken, and I should see one of the doctors. He said that it's probably something associated with what I do, and I should either get physical therapy or see one of the people that deals with rheumatoid arthritis or something like that.
But Bob, I think Dr. Morano gave you a great answer. Probably not rheumatoid arthritis, probably related to your work. Dr. Lapidus, what test should he get? What one test would help you the most?
Again, an MRI. An MRI is very good to look at the tendons, at the muscle, at the joint. It's something that will give a lot of information to the orthopedic doctor that you will see.
Bob, you got to get into your doctor and get him to order an MRI too, okay?
Thank you very much, Doc.
Have a good night.
All right.
Take care. We're now going to go, who's on our next caller? We get Brian. Hi, Brian.
Good night.
Brian.
Good night.
How are you doing?
Brian. I'm not doing good.
No, that's why you're calling us for some help?
Yes, I called for some help.
What can we do for you?
Oh, I have an head injury that I suffer since 95. I was being electrocuted with 11,000 volts.
Ooh. You were how were you electrocuted? What happened?
Well, I was working.
And
I was working.
What kind of work were you doing?
I'm an electrical technician.
And I guess were you wearing? Does that help if you wear sneakers?
Yeah, I wear everything I wear. But it's just that the clothes that I was wearing was very big and wet, so it hit the wire, and that is how I get electrocuted.
That's amazing. It's lucky you survived.
Yeah, everybody says that.
So what happened? Your heart stopped?
I didn't know anything. I was unconscious for 2 weeks.
Wow.
Oh my God.
This is terrible. It's a miracle that you're here with us.
Yeah, everybody told me that.
So what can we do? Now, you're having problems related to this?
Yes, I have a brain problem, which I do 7 MRI, and a set of brain shift in my head down to the back. Down to my vertical spinal
I'm sorry,
cord.
wait, I just want to make sure I have this right. You have brain chips? What was that?
They said that my brain was shifted because I felt like 30 to 35.
Oh, it shifted. Okay, the brain was probably, from the heat, the brain may have had damage at the time and have scarring in the brain and the heart. Are you having numbness now?
Sometimes I get it in my hands. But right now, my neck always hurt. I carry a dizziness for 24 hours a day.
You might have had, did you have any fractures of your neck when this happened?
No.
Because that can happen, when you get hit by such a shock. Where do you live?
I live in Canarsie.
Canarsie. I mean, it's something that you need to have a doctor following you for this, because to try and look at all the possible complications that occurred and make sure we're not missing something new that may not be related to the accident, as horrible as it was. Did any of the doctors, Dr. Khotsyna, have any thought?
That's right. Definitely. Please see your doctor, because it may not be even related to your trauma. It may be absolutely different symptom and a sign of a new condition that you're developing.
But this is a terrible. Have you seen anything like this, Dr. Morano?
Electrocutions. I don't deal with electrocutions, but the portal, entry and exit of the electrical charge, as well as lightning. People get hit by lightning. Usually they burn in those areas, and they cause neurological problems as well as tissue changes. So you really need to be examined and to be followed.
I saw some doctors at Kings County, and for the past 7 years.
Sometimes it's good to get a second opinion. You go to somebody for 7 years, they get locked into a diagnosis. Why don't you, if you want to give us a call at the hospital, we can get you maybe a second opinion with a neurologist.
Yeah, well, that is what I'm saying, because right now they said they want to do some operation on me. Thursday, I went to downstate and do a dizzy test. And because of my injury, I couldn't complete the test because they put some stuff on my head and put stuff in my ears, and it began to start to put water.
Oh, they did
The Radiology.
Yeah,
you know what I think you got to do is we got to. I would think not that there's anything wrong with downstate. They do an excellent job, but to get somebody who doesn't know your case just to look over everything and make sure that nobody's missing anything. I think that's important.
Yeah.
So if you want to give us a call, we
Probably
can.
a neurologist.
Yeah, we'll get you set up, or you can ask them for a second opinion at downstate.
No, well, at downstate, they told me one thing. Kings County told me one thing. Because what the doctors told me downstate is that I can get a stroke, I can stay just and collapse and just die just like that.
Yeah. Well,
you know, because I have a pain in my neck between the top of my head to my shoulder, and I carry pains right down both of my arms all the time.
So what I want to make sure you do is give a call in, because I don't think we have enough time to do justice to this, because this is a complicated case. You had a terrible injury. You might have had injury to the neck that you didn't even know about. So, again, give us a call tomorrow and we'll get you into the right person, all right?
Okay, on the same number?
The number's up on the screen now. Call that number. Okay?
Okay.
Bye. Take care. We now have Marlene.
Yes, Marlene speaking.
It's a nice name, Marlene.
Hi.
You have a deep voice. It's like, didn't Marlene Dietrich have a voice, a nice, similar voice? I hear that laugh, yes.
Yeah, thank you.
Did you like her?
Yes, my father called me Marlene because he loved her.
Sultry.
And that's why my name is Marlene.
Yeah. Where are you calling from?
I'm calling from Bensonhurst, Brooklyn, Bensonhurst.
That's where I'm from. I'm from Bensonhurst.
Dr. Morano says he's from Bensonhurst.
Yes, I think I know Dr. Morano. I've seen him around.
You've seen him around the neighborhood. Watch out those...
Don't tell my wife.
Watch out.
No, I just, I think maybe physically he'd been walking around, and I must have seen him in the street.
Yeah, no, that's
all.
Morano. You'll see him walking in the street.
Yeah. He's
I will take that.
What can we do for you,
about a month ago, I started to get the pain in my leg, especially my right leg, stabbing, shooting pain, and 2 days ago I had a very, very painful cramp in the middle of the night. So I did a sonogram about 3 weeks ago. They didn't find blood clot, or vaguely told me that was nerve condition.
Mm-hmm.
And yesterday I was diagnosed with diabetes type 2.
Mm-hmm.
And I wonder now, my question is that related to all this pain in my legs?
Two questions. I'm going to do two things. One, I'm going to ask Dr. Lapidus to tell us what test the Doppler is that they did on your foot, on your leg.
On my leg,
it's a very good test. We can look at the blood vessels very nicely with ultrasound, and to make sure that you didn't have a clot, which is very important.
No clot.
And once that's out of the way, we feel safer to go on and look at other causes of the pain.
Right.
Now, Dr. Margarita Khotsyna, as I call her by both names, out of respect, I would like to know about type 2 and type 1 diabetes. What's the difference? Tell our audience the difference between 1 and 2.
You know, the etiology, the cause of the diabetes is different. And, but what I was, when you were describing your symptoms, is that you're describing your pains in your legs as a shooting, right?
Yes,
and
that
that type of pain is very common in something that we call neuropathy, which is a nerve condition. It's a nerve damage. And when somebody is diagnosed with that condition, the next step is to look for the cause. And one of the most common causes of that type of neuropathy is the diabetes, which you were diagnosed. And based on your, how old are you, Marlene?
Marlene, how old are you?
How old are you?
I am 68 years old.
Right. I mean, not only based on your age, of course, but type 2 diabetes is much more common.
I'm on medication starting tonight. I mean, I just took my first pill.
Right. Okay. So that's, you know, that's very good. And usually, what happens as your diabetes gets better controlled, and your hemoglobin A1C should be at less than a 7. So the pain usually gets better. And plus, there is multiple medications that can be used to alleviate your pain.
See, I hope so, because I'm going to Europe and I really don't want to walk around with the kind of jolting my legs, too much action. No,
you should definitely just take your medications, follow up with your doctor, and you should definitely get better.
Very good.
Well,
Thank you very much.
Look out for Dr. Morano. Okay?
Yeah.
Take care. Hi, Rose.
Yes.
Hi, Rose. How are you?
I'm good.
Where are you calling from?
Sheepshead Bay.
Oh, beautiful. I was out. I was at that Sheepshead Bay. El Greco.
Oh, that's a diner.
The diner, yeah. What do you
No,
think?
I'll send you to the greatest Turkish restaurant on the bay.
Oh, I think I know it. What's the name?
Liman.
Liman.
Liman. Dr. Lapidus knows his stuff here.
The best.
That's not the one on the corner of Ocean Avenue and Evans?
No, this is, it's on the bay side, and it's next door to where there used to be a Dunkin' Donuts, which is closed up now, they say, for renovation, but I don't know.
Right.
But it's the best. Fresh fish,
Oh.
like you've never had before.
We're looking forward to that. So is there anyone in particular to ask for?
You mean as far as a server goes?
Maitre d', the waiter. So they know.
No, the service there is excellent. It doesn't matter who you get.
Very good. So we're going to look out for that fish, and we're going to give you a report back, okay?
Great. We were just there Sunday, and in addition to fish, they have meats and Turkish, what they call mezedes, which are the appetizers.
Excellent.
Well, I'm Greek, so we say mezedes. I don't know what the Turks say.
Very good. Dr. Morano speaks several languages. Oh. What was that?
Yiddish, a bissel?
What can we do for you, Rose?
Well, I have a question for Dr. Morano and Dr. Lapidus.
Okay.
Yes.
I had arthroscopic surgery on my left knee in 1991 and on my right knee in 2004. The left knee that I had done in 91, knock wood, was pretty good. The one that I had done in 2004 is a lot more painful, and arthritis has set in. And I can't really do steps the way normal people climb steps. I do it 1 foot and then another, like I'm going to be 75, and I say like an old lady, and I'm getting to be an old lady.
You sound good. Sound very good.
Thank you.
So what's the question? Because I only have a couple of minutes.
I was just wondering whether I should go for physical therapy to probably strengthen the knees.
Okay, first I'm going to ask Dr. Lapidus, is there any test you can do to evaluate?
No. The question I have for Dr. Lapidus is totally different.
Okay.
Oh, okay. So who's this for?
Dr. Morano.
So she's taking over the show, yeah? Okay, Dr. Morano's going to do
taking over the show.
Okay.
Here we go. Listen, it sounds what you're describing is osteoarthritis, and that develops depending on what they did on arthroscopy. If they removed the meniscus, but it sounds like you had arthroscopy because of meniscal problem or a possible tear in one of the ligaments or tendons there. And that is a secondary cause and a precipitating cause of osteoarthritis. And arthritis is basically the joint space gets narrowed with the loss of cartilage and the reabsorb the area where you can have cushioning between one bone and the other. You would benefit from therapy, weight loss, and there's a couple of medications that we could use. And
you can't even see me. How do you know?
Usually women who have arthritis of the knee tend to be overweight.
Yes.
Men who are overweight, takes a longer time for them to get arthritis. But
I had the Synvisc injections on my right knee, but they didn't work at all.
There's other things that can be tried, but to be proactive for yourself, try Aquacide and call the Arthritis Foundation. I never advocated them before, but they're very good to tell you what to do.
Right, we're going to have to move on because we only got 2 minutes left, okay?
Okay, I can't ask Dr. Lapidus a question?
Okay, just give that. What's the question?
Well, I had a CAT scan 2 years ago when they noticed an aorta, an abdominal aneurysm.
Right.
And last year I had a sonogram, and it hadn't changed in any way. And I was just wondering what follow-up I should do.
Excellent. You had the CAT scan, which really shows the whole aorta and gives a very good detailed image of the aorta.
No, it wasn't the aorta, it was the abdominal.
Abdominal aorta.
Oh, okay.
Right, so it's abdominal aorta. Aorta goes through the chest, the abdomen, pelvis. So you have an abdominal aortic aneurysm. The CAT scan initially shows us very beautifully everything that has to do with the vessels, but ultrasound is also very good. So following with ultrasound is very acceptable, and as long as there is no change and it stays under certain size, nothing needs to be done.
Have a great week. Talk to you next week. Take care. Hi, Margie.
Yes.
Margie, how are you doing?
I'm fine.
What can we do for you?
Okay. I'm calling because, for one thing, I had a knot in my breast. It was taken out, my left breast.
Mm-hmm.
Like they took a lot of tissue out with it. So it made my left breast small.
Uh-huh.
Right? Now my right breast is big, and it's starting to pull on the ligaments in my chest, that goes to my shoulder, and it hurts real bad, right? I went to the doctor. They said for me I have to wear my bra all the time or get a breast reduction. Okay, all right. What I want to know, am I too old to get a breast reduction?
How old are you?
I'm 58, wait a minute, but I have medical problems.
Okay. You know, we had a plastic surgeon here last week, and I'll let one of the doctors also give the opinion, but I don't think that you're too old, that you can do breast reconstruction and breast reduction on patients, and you seem to have one of the indications, which is pain. You're having problem with it.
Yes.
So I'll throw it up to Dr. Khotsyna.
Yeah, but I think breast reduction, the indication for breast reduction is not only to make it look better, it can definitely have some medical indications, which you clearly have. If it causes you tremendous pain and discomfort and it affects your life, it's, I would definitely suggest you just speak to your doctor about it. And you absolutely, I mean, you're not too old for,
Dr.
of course,
Lapidus,
for not.
the last
for
word
not
here.
I just want to, well, I just want to make sure that you get your annual mammograms. And that you get checked, and if you're going to do breast reduction, that you really have a good mammogram, both sides, to make sure that everything is okay, and then go ahead and just make sure that you continue with your annual exams.
Okay, so I hope that's good news for you. And you got to get to the right doctor. So, you know, if you need any help, you give us a call. Make sure you get to the right plastic surgeon.
Okay.
Okay, have a good week.
Thank you.
Okay, I can't believe it. I mean, we have people waiting to be called, but we're out of time again. It just flies by here. So what I can say is that's it for this edition of Ask the Doctor. I'd like to thank Dr. Khotsyna, Dr. Morano, Dr. Lapidus for coming in here. And we hope we've been able to help you. And it's always good to remember to be proactive about your health. Speak to doctors about your concerns. Go for second or third opinions. In the meantime, continue to watch the show every Tuesday night or visit our website at ny.net/askthedoctor. There you can do many things, like watch the special blogs, the video blogs, see past episodes, or just send in questions. I want to thank you all for your calls tonight. We'll see you again next week at 8 p.m. sharp, so don't be late. Goodbye, stay healthy, and I'll see you in the tablet.